What is the purpose of augmentative alternative communication? Option A, to teach numeracy skills. Option B, to encourage activities of the daily living. Option C, to support literacy skills. Option D, to provide the best opportunity for developing language and communication. Answer is D. The augmentative and alternative communication is a different way to communicate for the impairment and disability pattern of individual with a severe expression communication disorder. The augmentative alternative communication purpose is to provide the best opportunity for developing language and communication. What is the most common sexually transmitted infection in the UK? Option A, syphilis. Option B, gonorrhea. Option C, chlamydia. Option D, HIV. The answer is C, chlamydia. Chronic obstructive pulmonary disease may be caused by which lifestyle factor? Option A, recreational drug use. Option B, poor diet. Option C, smoking. Option D, a lack of physical activities. Answer is C, smoking. The chemical or toxin in a cigarette smoke weakens the lungs and defends against infections. Narrow air passage cause swelling in the air tube and destroy air sac. These all are contributing factors for COPD. How does a nurse contribute to quality improvement strategy? Option A, by participating in audit and feedback exercises. Option B, by giving a staff extra break on shift. Option C, by encouraging relatives to interact with the staff. Option D, by ensuring the working environment is clean at all times. The correct answer is A, by participating in audit and feedback exercises. What action does a nurse in charge take if a new healthcare assistant is not performing hand hygiene using the approved 7-step method before delivering direct care to patient? Option A, report the observed incident to the ward manager and insist that arrangements are made to train all the healthcare assistants. Option B, stop them from carrying out direct care to the patient, teach them the approved method and reassess their competence. Option C, allow them to continue with delivering care and reprimand them for unsafe practice later in private. Option D, report the matter to the ward manager upon completion of their shift. The answer is B, stop them from carrying out direct care to the patient, teach them the approved method and reassess their competence. Why does a nurse wear PPE when barrier nursing a patient? Option A, to prevent their hand from dryness and damage. Option B, to prevent themselves and the patient from transferring of infection. Option C, to be able to save money as the PPE can be reused. Option D, to save having to wash their uniform after the shift. Answer is B, nurse wear the PPE to prevent themselves and the patient from the transferring of infection. What is the role of a clinical audit nurse? Option A, to collect data for revalidation record. Option B, to collect data for financial records. Option C, collect data on clinical care. Option D, to collect data for training. Answer is C. The role of clinical audit nurse is to collect data on clinical care. What does a nurse say when a nursing colleague saw their reflective journal and ask for advice on keeping one? Option A, they need to keep a journal which include detail about fellow staff. Option B, they do not need to do this as it is not a good learning tool. Option C, they need to keep a journal which include detail about patient they have cared for. Option D, they do not need to keep a journal which reflect and evaluate their one practice. Answer is D. They do not need to keep a journal which reflect and evaluate their one practice. A patient has a learning disability affecting language. How does a nurse provide information to them? Option A, tell the patient verbally and hope they understand. Option B, tell the patient family who will pass it on. Option C, leave a copy of word communication picture card next to the patient bed. Option D, use the word communication picture card with the patient to provide information. Answer is D. If the patient is having learning disability which affecting the patient language and communication, you can use the word communication picture card with the patient to provide information. Which approach does a nurse take when working with a patient and carer from different cultures? Option A. It depends on each culture and some cultural needs cannot be met. Option B. Encourage the patient to adapt to the care environment and get to know how things are done. Option C. Ask the patient how they would like to be cared for and encourage them to express their personal culture need. Option D. Treat everyone as you would like to be treated. Answer is C. Ask the patient how they would like to be cared for and encourage them to express their personal cultural need. The nurse is providing body care with a previously unused product. What is the correct action? Option A. Refer to another practitioner for the best interest of the patient until they have developed their own skill and knowledge. Option B. Contact their manager at the end of their shift and seek their advice about the wound care. Option C. Leave the original dressing on and leave the dressing to someone else on the next shift. Option D. Try their best to care for wound using the available product. Answer is A. If the nurse is providing body care with a product that she has never used before, she need to refer to the another practitioner for the best interest of the patient until they have developed their own skill and knowledge. What course of action does a nurse take when a patient has been harmed? Option A. Document the event formally and escalate appropriately. Option B. Try to establish who was at fault. Option C. Isolate the patient to prevent further harm. Option D. Inform the other patient of the incident. Answer is A. If the patient has been harmed, you have to escalate appropriately to the line manager or to the in charge, and then you have to document the event formally, including date, time, step taken to deal, and then to whom you have escalated. What is the main aim of partnership collaboration? Option A. Positive patient episode. Option B. Positive staff experience. Option C. Positive patient experience. Option D. Positive patient event. Answer is C. The aim of the partnership collaboration is positive patient experience. What does standard precautions means when caring for a patient? Option A. High-level precautions which include all disposable bedding and utensils for all healthcare staff. Option B. Basic infection prevention and control measures which include hand hygiene and safe disposal of all waste by all staff at all times. Option C is taking precautions when handling blood and the high-risk body fluid for relevant medical personnel. Option D is selective precautions which involve safe disposal of clinical waste for all persons involved in the care process. Standard precaution means basic infection prevention and control measures which include hand hygiene and safe disposal of all waste by all staff at all times. What is the sign of new dehydration in a healthy adult? Option A. Warm extremities, moist skin. Option B. High blood pressure. Option C. Increased heart rate, dry mouth and skin, dizziness, low blood pressure. Option D is decreased heart rate. In a healthy adult, the sign of new dehydration are increased heart rate, dry mouth and skin, dizziness, low blood pressure. Nurses working with a patient who has experienced a stroke and is reluctant to join in exercise group due to their limited mobility, how does the nurse respond? Option A. Encourage them to sit and watch the group and decide if they want to join in next time. Option B. Introduce them to others in the group. Option C. Agree not to involve them as it is their choice. Option D. Agree that it will probably be too much for them and do not ask again. Answer is A. If the patient is reluctant to join in exercise group due to their limited mobility, you can encourage them to sit and watch the group and decide if they want to join in the next time. Which equipment is used for a patient who requires 2 liters of oxygen? Option A. Humidified oxygen. Option B. Nasal cannula. Option C. Continuous positive airway pressure. Option D. Reservoir mask. Answer is a B, nasal cannula. So the nasal cannula can be used for the patient who require up to 4 to 6 liters per minute of supplement oxygen. As this patient also require 2 liters of oxygen, so the nasal cannula can be appropriate for this patient. A patient has a patient-controlled analgesia morphine pump. A nurse noticed that patient become drowsy and his respiration rate is 7. What action does the nurse take? Option A. Check the pump. Perform A to E assessment. Option B. Stop the pump. Give naloxone and paracetamol. Option C. Keep the pump going. Administer naloxone. Refer to the pain team. Option D. Stop the pump. Start A2 assessment. Prepare or give naloxone. Answer is a D. If the patient is in the patient controlled analgesic morphine pump and the patient become drowsy and also the respiration rate is 7, then you have to stop the pump and start to do the A2 assessment. A2 assessment is airway, breathing, circulation, legibility and exposure assessment. And after that you have to prepare the naloxone and give the naloxone. So the naloxone is given to the acquired induced respiratory depression as the morphine is acquired medication. Discharge planning commenced at option A, first contact, third contact, option C, second contact, and option D is fourth contact. Option is A, so the discharge planning is start at the first contact with the patient during the admission. According to the Nursing and Midwifery Council (NMC), a comprehensive nursing assessment should include which factor? Option A, biological, psychological and social factors. Option B, anatomical, physiological, medical, pharmaceutical, genetics and economic factors. Option C, cultural, economic, anthropological, medical, pathological and physical factors. Option D, physical, social, cultural, psychological, spiritual, genetic and environmental factors. The correct answer is D, physical, social, cultural, psychological, spiritual, genetic and environmental factors. Thank you for watching. Please like it and subscribe to my channel. Press the bell icon to get more video. Keep watching, keep supporting. Thank you.